Well, as you age, you may notice some sagging skin, maybe some more dryness, some fine lines, and those are really things that you can do. There are things you can do to get a more youthful look on that.
Absolutely. We all want to look younger, right? Well, our next guest is the first physician in Omaha to offer the Aqua Gold Fine Touch microneedling treatment. Get ready to regain your confidence.
That doctor is Dr. Joel Schlessinger. Good to see you, doctor.
Great to be here.
Back.
Thanks for swinging by. We're going to talk about this microneedling, but first of all, I want to get something out of the way. There's a new approval for
Botox.
Yeah, tell us about this.
Yeah, so I just came back from the American Society for Dermatologic Surgery meeting in Chicago, and Botox now has a new approval. It's not really news for those of us who have used Botox for going on 20 years, but forehead lines, those pesky forehead lines, are now approved for treatment by Botox. So for the longest time, Botox has been approved for now frown lines, like the two glabellar frown lines that people see, and most recently crow's feet. But forehead lines, which we've treated for ages, have never been approved. So now it's approved, and the nice thing is that we're going to see more and more about it. Now, there are people who haven't treated them because they just didn't know about it, and now with this ability for Allergan, the maker of Botox, to talk about it publicly, now we can see that. The other thing is that there is some competition in this field. So I was at a party, got to meet Christy Brinkley, and she is, yes, fabulous looking, age 63.
Oh yeah, she's over 60.
She's 62, 63.
Amazing.
Looks great.
Amazing. You know, we got the chance to see her. She's going to be promoting another neurotoxin like Botox called Xeomin that we actually did the clinical trials on. So it's going to be a very interesting game between Allergan, Mertz, which owns Xeomin, and also Galderma, which owns Dysport, about all these neurotoxins, all these types of things that relax wrinkles.
Well, very exciting news.
Yeah.
Congrats. That's very good. Well, other ways to look younger and work on that youthful appearance, microneedling. So how does this work? What is it?
Yeah, you know, microneedling is something that has been around for a while as well, but you know, they have been refining it. So we started off with just simple microneedling. And so you can see on that picture, there is a needle that comes up and goes into the skin.
Sure, yeah.
Now we have microneedling along with radiofrequency. So this device has radiofrequency along with the microneedling, and it's a very nice way to provide a pick-me-up. So the whole idea here is that we want to have collagen stimulated in so many different ways. Collagen is the building block of the skin. So the more we're able to stimulate it, the better your skin looks. And it's not just as simple as a peel, because peels are great, but you need to get inside. So that microneedling allows, and this is Aqua Gold.
Yeah, how does that play?
That's a non-radio frequency, but that allows us to add Botox and fillers with the microneedling as you're doing it, which is kind of cool. So it allows us to treat a whole area like the chest, the hands, the neck, the face very quickly, and it allows us to make very subtle changes not only in the collagen but in the structure of the skin, because you have that micro application of Botox and micro application of filler into those areas. So two different ways of going with microneedling that are kind of an evolution in the microneedling story. So in other words, we have microneedling for maybe 10, 15 years. They had things like rollers and stuff like that, but they just weren't doing the job without having some little extra oomph to it. So that extra oomph, that's the energy, radio frequency, and also the application of Botox and fillers with it, which, you know, it's a great opportunity for us to perk up the skin.
Yeah.
It alone isn't going to do the entire job. Botox alone isn't going to do the entire job. It's kind of a palette of things that we use to make people look their best.
And what type of results are people seeing with that, with the Aqua Gold and the microneedling?
Yeah, I think we have some pictures. So you can see the mouth there.
Oh,
it's a
wow, look
great
at that.
area to make a nice difference in the skin, you can see her skin is really improved. Not only is it less red, but it's also better as far as the character of the skin. And that's
much better.
That's just with AquaGold. That's the AquaGold on the face, mouth, and neck. And then we have one person, she had a full face radio frequency, so the EndyMed. And you can see what a difference it makes. It just clarifies the skin.
It smooths things out a little bit,
She's just
doesn't it?
glowing. I mean, it's just, what a world of a difference.
I think that there's so many things that we're learning about keeping the skin at its optimal best. And that's the idea here. So we have a lot of tools available to us, and it's just finding out what we're going to do, using it in the right manner, and finding when it's appropriate to tweak this, when it's appropriate to tweak that, to make that person look their most youthful.
So doctor, tell us, who's a good candidate for microneedling?
Well, you know, anybody can do it because it's something that stimulates the collagen at any age, whether you're 30, 40, 50. But I think that the best age is probably about 30 to 55, 60, something around that age, because your collagen still is able to be stimulated. Our collagen goes from being kind of this very, very fine, wavy, cloud-like collagen to being this kind of curled up, gnarly collagen when you're really, really past the point of no return. And so we want to keep it from getting to the gnarly type. We want it to be kind of the...
Start earlier.
Now let's do a rapid fire, because we've only got about 30 seconds left. Okay, downtime. What's the downtime like?
Essentially none for AquaGold or microneedling.
And then how fast do you see results after a treatment?
After about a couple of days, you're going to start to see improvements.
And then the results last how long?
They last for several months to, you know, generally we'll do about one treatment every couple of months.
Okay.
Yeah.
Very good.
Well,
Dr. Joel Schlessinger right there.
Skin specialist off Oakview Drive, lovelyskin.com/dermatology, or call 402-334-7546.
And that's what we love about having you on. You have all the latest technology. You're out at these conferences. You're talking to the people that have all the scoop on all this. You know what you're talking about, Doctor.
You do.
Thank you.
Found it.
And kind of fun. We also did this on Facebook Live from my
We
Facebook Live.
Yes, check out the video if you want to see that again.
Dual Live on Channel 3 and Facebook Live at the same time.
Yeah, live. Well,
Thank you
so
guys.
much.
Have a great weekend, Doctor. Guest of the Morning Blend starts.